অসংখ্য ধন্যবাদ ডাক্তার অনুপম পোদ্দার স্যার। আমি আমার পরবর্তী প্রশ্নের জন্য আহ ডাক্তার বালাজি মোনাহার স্যারের কাছে যেতে চাই। গুড ইভিনিং স্যার।
Good evening. Happy New Year to all the viewers who are watching. And it's a pleasure once again to be with you all and with Raj TV.
It's a pleasure for us too, sir, to have you on our show. And thank you
Thank
again
you.
for your precious time. স্যার, আমরা একটু আপনার কাছ থেকে জেনে নিব। দর্শক, আমি একটু বলে রাখি, স্যারের কাছ থেকে আমরা জানার চেষ্টা করব আঁকাবাঁকা দাঁতের চিকিৎসার কারণে মাড়ির উপর কি প্রতিক্রিয়া হয়। স্যার, হোয়াট ইজ দ্য ইফেক্ট অফ অর্থোডন্টিক ট্রিটমেন্ট অন পেরিওডন্টিয়াম?
First of all, I think Dr. Anupam has already described so much about the interrelationship between the two specialities of dentistry, orthodontics and periodontics. In whatever Bengali I can understand, I have tried to understand that more or less he has told many things about the orthodontic treatment and the response of the periodontal tissue or the gums and the bone, which in common language we are telling. Now, whenever orthodontic treatment which is being done, we understand that to move the teeth, there is going to be some amount of force which is going to be applied. Now, this force which is being applied, we all know, many of us would have seen your neighbors or somebody in your family who are undergoing this treatment. There are some brackets placed on the tooth, and there is wire placed on these brackets, and there are some elastics, rubber band type of elastics which are given, which are going to exert some force so that the teeth can be pulled behind, or whether there is, when there is space present, that space can close because of the force which is going to be exerted by these elastics onto this. Now, whenever a force is going to be applied, we all know when the tooth is going to move because of this force, it is going to be a pathologic movement which is going to be. But this pathologic movement, when we are telling, it is a controlled pathologic movement, because the force is decided by the orthodontist, how much force is going to be applied. So there is going to be a controlled pathology which is going to be applied onto the tooth. Now, once this force is going to be applied, definitely the structures which are beneath the tooth, which is not visible to our eyes, which are supporting the tooth into the bone in which it is present, there are small invisible structures like the periodontal ligament which is present, which is connecting the tooth on one side to the bone on the other side. There is going to be some amount of damage which is going to take place on these things because of the force which is being applied. So eventually the bone which is present, that also there will be some amount of destruction, or I should say resorption of the bone which will take place. Now, whenever this orthodontic force, which I told is going to be applied, definitely on the gingiva, the gums that is, and the other structures which I told, there is some changes which will occur. So what type of changes do we expect to see when these type of forces are going to be applied? There will be the gums which are there. We might see that if the forces are a little bit excessive, there might be the gums will recede. So the tooth start appearing a little bit longer than they are, because the gums will start going down, or start leaving its place and start coming down. And I already told you about that there will be some bone which starts getting resorbed. There might be destruction which might take place. And more or less, we also see that there is pocket formations, periodontal pocket formations, which might be seen. Along with this, a lot of studies which for a general public is what I would tell is there is some amount of gingival or gum inflammation or redness and swelling might be seen. There might be some amount of bleeding which might be seen by the patient, because he is not able to maintain the oral hygiene. So definitely not to criticize anything or anything like that, but some amount of detrimental changes do occur in patients who are undergoing orthodontic treatment. That's what I would like to say here. Thank you.